Okay, thank you. So leave management to the professionals. Medical centers or hospitals have evolved from being straightforward centers of advice and healing based in temples in ancient Greece into today's complex organizations. But it was not changing. That's why I'm keeping
Wait. Share full
like
screen.
that so that we don't
share full screen. What's happened? Hello?
Just wait, ma'am.
Yeah. Take your time.
His time is ticking away.
So can you see now?
Now we can see.
I mean, we can keep it like this only. Otherwise, I mean, we'll change time.
Okay.
Okay. So yeah. So medical centers or hospitals have evolved from being straightforward centers of advice and healing based in temples in ancient Greece into now today's a complex organization. So what is a popular perception is that hospitals are all about doctors and nurses. That is, in our case, doctors are mainly involved in these doing surgeries, and in sisters are mainly in assisting us in the clinical work. But these two, that is, these doctors doing surgeries and sisters helping in clinical, doesn't make a hospital.
It's not my
So in reality,
send your mail.
If a hospital function efficiently and seamlessly, then we have to look for that hidden person behind the scene who looks after the facilities management in a hospital. So what are the things that goes behind the scene activities for a smooth running of a hospital, like patient care services, front office, pharmacy, cleanliness, small thing like staff lunch and tea, staff leave management, staff salary, payout, pay in to different companies, staff maintaining the staff timetable, then legal statutory responsibility like the municipality or the parking permissions, logistics, supply, hospital safety, fire planning, decision making, quality management, whether the microbiologists have taken the slides from the OT or not, biomedical waste management, and this list is not exhaustive. So if doctors decide that their principal concern was to ensure the smooth running of the system and delivery of a policy irrespective of consequence for the patient in front of them, then both the quality of care and public support would collapse. That is the primarily doctors need to worry more about the patient outcomes. Now, that's why the major function can be distributed or divided into two things: patient care function and a managerial function. Patient care function is by the doctors, and what are the managerial function that we have to see? That is administration, or how a hospital is managed. That is a set of day-to-day activities that are related to financial planning, record keeping, billing, human resource management, physical distribution, logistics within an organization, which is in our case is a clinic or a hospital. So healthcare management is a high-profile job that requires a skill set with administrative capacity, crisis management skills, sound medical experience, and some financial knowledge also. This person or healthcare manager have to ensure that all documentation related to the patient is accurately taken care of. We have to see that instruments in the hospitals are sterilized in our case, or in some instances, he have to give proper hospital manager have to communicate detailed medical reports to the patient and their family. He also ensure the proper inventory in our hospital, maintain human resources, and also make sure that the policies and rules are duly implemented. So thus, a competent manager plays a crucial role in implementing various measures to patient inflow, quality, and care. So when I say leave management to the specialist, who is a specialist? He can be our store manager, center manager, or a HR manager, or that guy who is with our trusted or is with us long and who is jack of all trades and master at managing our organization. Just one or two slides. In fact, in our centers, we already have that guy who is doing all these activities, and just that we don't acknowledge, or maybe that we doctors think we are the super doctors or Superman doctors, that we are only managing this hospital smoothly. And this is not only I am saying. British Medical Journal also did a study in the role of hospital managers in quality and patient safety, and they also found that a manager's time spent in work can influence the quality or safety, clinical outcome, and process performance. So my friends in the panel who are opposed to this idea, there cannot be a better way for a smooth running in our clinic than leaving the management to the specialist.